welcome you back to the program. Good to have you staying with us today. You know, unfortunately for a lot of us as we age, one of the realities is that of aches and pains, and it's been estimated that over half of the Americans live in chronic or recurrent pain. One study found that 76 million Americans live with pain every day, which is about 25% of our U.S. population. A lot of ways that we cope with it. Some people say, well, mind over matter, I'll just ignore it, it'll go away. Some people revert to medications. Some people are kind of embarrassed to go to their doctor and talk about it. So there's a lot of ways we really deal and cope with it. But our next guest is somebody who's got a unique way that people can deal with and cope with pain. Heather ONeill is with us today. She's a registered nurse and Vice President of Field Operations with Advanced Therapy Solutions. Heather, welcome to the show.
Well, thank you so much for having me, and it's great to be here. I'm just so excited to talk about this therapy we have for individuals with chronic pain. It is FDA approved for chronic pain. And you were talking about the numbers of Americans who have chronic pain. A lot of them ignore it, they live with it, they think it's normal. 41% of the population believes that chronic pain is a normal process of aging, but it's not. It's telling us that there's something wrong with our bodies. And
now in some cases there could be some physical, correctable physical condition, you know, an injury, a sports injury, or just some other issue that a doctor might be able to treat in a conventional way. But what you're saying is your product is for maybe some of those that don't respond to normal treatments.
The therapy we have is a type of electrotherapy. Okay. And what's so great about this therapy is it doesn't just block pain. We're not masking pain, but we're therapeutically mitigating pain.
Because that's really what drugs do.
Yes.
Is mask the pain.
Absolutely. And there are other types of electrotherapy that block pain as well. But with this therapy, we're improving microcirculation, decreasing edema, which is swelling, and if the joints are affected, we're improving range of motion, which is mobility. Now, 34% of those with chronic pain believe that the side effects from the medications they are prescribed is worse than the actual pain itself. And 36% refuse to take any type of pain medication because they fear becoming addicted.
And I'd face it, anytime we add chemicals in our body, there's always that. And if you ever, when you get a prescription, there's always that page of little tiny print that lists potential side effects and potential counterindications on that. I've heard of something that sounds like what you're talking about. It's called a TENS machine. Yours is not that. Yours is something a little bit newer and different.
I'm glad you brought that up because there is some confusion there. Electrotherapy has been used in medicine for decades. Examples are cardiac pacemakers, neuromuscular stimulators, defibrillators, and TENS units. These are all types of electrotherapy used for different purposes, and they use different types of energy. Let me show you. So this is our unit.
Okay.
And it's electrical stimulation. Typically, with the TENS unit or other types of external, you're going to see these. These are electrodes.
Right.
These are stick-on electrodes.
Sure.
And you put them around the site of injury or the site of pain.
And then you hook it up to the machine.
And the machine's typically, you know, fairly large.
Yeah. So it's all not all that easily to carry around and have your normal activities with. This is basically based on garments, and I know that you're showing us the sock one today. It also comes in a glove, I believe, and some other configurations as well. So, and the unit obviously is small. Oh, there we go. There's the glove. So it would be a similar type of deal.
Yes, this is good for individuals with arthritis, carpal tunnel syndrome, RSD, or CRPS, which is complex regional pain syndrome.
Okay, so the glove itself is designed to hook up with the machine, and these little snaps here is actually where, I guess, the electrodes, positive and negative, will hook up. So, okay, electrical charge goes between the wires, but I understand there's something in the glove itself that makes it conductive as well.
Yes, it is ionized and plated with silver, which is very conductive. This is the energy, and this is how we drive the energy into the tissues. And we also have a cream. You need to be well hydrated. You need a moist environment for this to be conductive. So we actually have a cream that you can put on your leg and on your arm before you put on the garment. Now, just to tell you a little bit how this therapy is different than a standard TENS units, for example. We like to call this the pacemaker for circulation.
Okay.
We use a very low intensity current at the microampere range. So just to put that in perspective, a 9-volt battery generates 90 volts. This is 1/1,000,000th of 1 amp.
People that may have gone in for physical therapy and had a technique done with electrical stimulation, the description I've heard is it's ants crawling on your feet.
Yes.
Is that the feeling you're going to get with this?
This is subsensory because we are using a low current, means you can't feel it.
Okay, so you wouldn't have the, as one person has described it, the ants crawling on your feet
Correct.
syndrome.
Correct.
You would probably not feel anything other than the pain would decrease. Is that the concept?
That is correct.
Okay. How long can someone wear this in the average day? Can they wear this during their normal business day, during normal waking hours? Can someone sleep in this? What's the on-off time on this?
Yes, you can wear this based on your lifestyle. We recommend nocturnal, nighttime treatment because our bodies go through a natural healing at night. Also, for those that have neuropathy, that's one of the conditions that we most commonly treat. There are 100 types of neuropathy, diabetic neuropathy being the #1. And you get this burning sensation, tingling in the feet, just a lot of funny things happen because you have nerve damage. And with this, wearing it at night, our bodies, usually we shunt blood flow to our extremities at night. So by wearing this at night, we're increasing the microcirculation at night, so now you're going to have decreased pain at night.
Okay.
So nocturnal treatment, 8-hour treatment is what we recommend, but you can also wear it during the day, an hour during the day, just depends on your disease process.
Okay, so again, everybody's an individual, everybody would need a different application, and do they control the output of this thing, or is that pre-programmed by your staff or by a doctor? How do you program the amount of energy it's going to use?
We keep it very simple, it's pre-programmed. We titrate it. It goes up to 100 volts, and we do the education. So we teach anyone that we work with on this product how to do this, where you titrate it up until you can feel it, and then when you can feel it, you drop it down, again, subsensory, where you can't feel it. Because we are working with our body's own natural current. We produce an electrical current in our cells, and we are mimicking that, and we are wanting to jumpstart our body's own natural healing process.
It sounds like a unique concept and a good way to deal with pain. I think one question a lot of our viewers might ask is, does insurance pay for it?
Yes, it does. It is reimbursed by Medicare and most other insurances, and workman's comp as well.
Do people get recommended by their doctor? Do they deal with you folks direct? How does somebody get more information?
We do need a prescription for this. And once we get a prescription from the physician, let's say somebody's listening today and they think this would help them or a loved one. They would need to get a prescription from their doctor. If they need any guidance, call our 800 number. Once we get that prescription, we meet with the patient or the individual, show them how to use the therapy. If the doctor is not familiar with the therapy, we can go into the doctor's office and explain to them the therapy so that they will feel more comfortable prescribing it.
So it sounds like education is as big a part as actually having developed the product and making it available, really educating the physicians as well as educating the patient as well. Sounds like important.
Yes.
Heather, thank you so much for joining us today. A very interesting product, and again, something that might be of interest to you folks out there, especially if you're dealing with a chronic pain situation, a drug-free way to deal with pain. Thanks for joining us on the program today.
Thank you for having me.
We'll continue on with more right after this brief time out. Stay with us. I'm assuming.
Missing teeth? Need implants? Dr. Leif Loberg at Loberg Professional Dental Corporation is a courteous, gentle, and friendly dentist who can give you new teeth in about an hour. Dr. Loberg's expertise makes him one of Orange County's teeth implant specialists. New chiclets. Nice.
Available from Loberg Professional Dental Corporation. Call 949-586-1930 or visit drloberg.com.
Beautiful, isn't it? From San Diego to the Oregon border, California has over 840 miles of coastline. We have wide sandy beaches, most of it pristine and attractive. And we can keep it that way if we handle our waste and litter properly. Did you know that Americans throw away 2.5 million plastic bottles every hour? And although we are smoking fewer cigarettes, cigarette butts continue to be the most commonly discarded litter. Cigarette filters are a threat to our wildlife, which can ingest them, and they are a threat to our environment in terms of fire. Discarded toxin-filled cigarette butts work their way to our waterways,